Good afternoon, fellow teachers. Today, I will be sharing a simple presentation for us, especially for those who are experiencing a mental health issue. So let's proceed. I want you to watch this video and think about how you feel in these scenarios. Thank you for watching. So now, how do you feel about this video? Do you feel afraid? Are you sad? Or any negative feeling? So some of us will say yes and some of us will say no. So tungkol saan nga ba yung video na to? So yung video na pinanood natin. This video or these scenarios are the calamities that are continuously happening in our country or in the Philippines. And worse is the COVID-19 pandemic. This COVID-19 pandemic has presented challenges to public health, food system, world of work, educational system, and business. And these have impacted the mental health of most Filipinos. What is mental health?
It is all about how people think, feel, and act.
What are the impacts of having issues with mental health?
Mental health can affect daily living, relationship, and physical health.
Who are vulnerable to have mental health disorder?
Everyone has some risk of developing mental health disorder, no matter how their age, gender, income, or ethnicity.
What are the differences between depression and anxiety?
Anxiety, fear, apprehension. Depression, sadness, loss of hope. Anxiety, heart palpitation, agitation, difficulty breathing. Depression, no desire, fatigue, lack of energy. Anxiety, care too much about everything, difficulty relaxing. Depression, cares too little of everything, loss of interest. Anxiety, thoughts of the past and or future, unable to live in the present moment, depression, suicidal thoughts, anxiety, difficulty focusing, concentrating, and sleeping, depression, lack of focus and concentration but mostly would rather sleep.
What are anxiety disorders?
Anxiety. Anxiety is your body's natural response to stress. It's a feeling of fear or apprehension about what's to come. For example, the first day of school, going to a job interview, or giving a speech. These may cause people to feel fearful and nervous, and it is normal. But if your feelings of anxiety are extreme, last longer than 6 months, and are interfering with your life, you may have an anxiety disorder.
What are the types of anxiety disorder?
First, panic disorder. Experiencing recurring panic attacks at unexpected times. A person with panic disorder may live in fear of the next panic attack. So, meaning to say, if you had experienced panic attacks or you live in fear of having another panic attack after experiencing one, you may have a panic disorder. Panic attacks produce intense fear that begins suddenly, often with no warning. An attack typically lasts for 10 to 20 minutes, but in extreme cases, symptoms may last for more than an hour. So this type of anxiety disorder is what I had experienced during my anxiety days. Now, I live in fear of having another panic attack. But now, I know how to deal with it. Second, phobia. Excessive fear of a specific object, situation, or activity. A phobia is an excessive and irrational fear reaction. If you have a phobia, you may experience a deep sense of dread or panic when you encounter the source of your fear. The fear can be of a certain place, situation, or object. For example, you had experienced an accident. Then you see someone hit by a car. So, dun mag-trigger yung phobia at magkakos ng fear. Unlike general anxiety disorders, a phobia is usually connected to something specific. Third, social anxiety disorder. Extreme fear of being judged by others in social situations. So, social anxiety disorder, sometimes referred to as social phobia. It is a type of anxiety disorder that causes extreme fear in social settings. People with this disorder have trouble talking to people, meeting new people, and attending social gatherings. They fear being judged or scrutinized by others. They may understand that their fears are irrational or unreasonable, but feel powerless to overcome them. Social anxiety is different from shyness. Shyness is usually short-term and doesn't disrupt one's life. But social anxiety is persistent and debilitating. It can affect one's ability to work, attend school, and develop close relationship with people outside or of their family. Fourth, obsessive-compulsive disorder. Recurring irrational thoughts that lead you to perform specific, repeated behaviors. OCD or obsessive-compulsive disorder is a chronic mental health condition characterized by obsessions which lead to compulsive behaviors. For example, people often double-check to make sure they've locked the front door or always wear their lucky socks on game days. These simple rituals or habits that make them feel more secure. OCD or obsessive compulsive disorder goes beyond double-checking something or practicing a game day ritual. Someone diagnosed with OCD feels compelled to act out certain rituals repeatedly, even if they don't want to, and even if it complicates their life unnecessarily. Fifth, separation anxiety. Fear of being away from home or loved ones. Separation anxiety is a normal part of childhood development. It commonly occurs in babies between 8 and 12 months old, and usually disappears around age 2. However, it can also occur in adults. Some children have symptoms of separation anxiety during their grade school and teenage years. 3 to 4% trusted source of children have separation anxiety disorder. Separation anxiety disorder tends to indicate general mood and mental health issues. Around 1/3 of children with separation anxiety disorder will be diagnosed with mental illness as an adult. We teachers, especially mothers, should know if their child or their children experiencing separation anxiety. So here are the symptoms. Clinging to parents, extreme and severe crying, refusal to do things that require separation, physical illness such as headaches or vomiting, violent, emotional temper tantrums, refusal to go to school, poor school performance, failure to interact in a healthy manner with other children, refusing to sleep alone, and nightmares. Sixth, illness anxiety disorder. Anxiety about your health, formerly called hypochondria. Health anxiety is marked by constant belief that you have a symptom or symptoms of a severe illness. You may become so consumed by worry that the distress becomes disabling. You will also feel extreme distress about your real or imagined symptoms even after medical test results come back negative and doctors reassure you that you're healthy. Meaning to say, you're being paranoid. You always think that you have severe illness even after normal medical result. And last, post-traumatic stress disorder or PTSD. Anxiety following a traumatic event. Post-traumatic stress disorder or PTSD is a mental health disorder that begins after a traumatic event. That event may involve a real or perceived threat of injury or death. This include a natural disaster like an earthquake or tornado, military combat, physical or sexual assault or abuse, and an accident. People with PTSD feel a heightened sense of danger. Their natural fight response is altered, causing them to feel stressed or fearful, even when they are safe. But PTSD can happen to anyone at any age. It occurs as a response to chemical and neuronal changes in the brain after exposure to threatening events. Having PTSD doesn't mean you're flawed or weak.
What are the symptoms of anxiety?
Anxiety feels different depending on the person experiencing it. Feelings can range from butterflies into your stomach to a racing heart. You might feel out of control, like there's a disconnect between your mind and body. Other ways people experience anxiety include nightmares, panic attacks, and painful thoughts or memories that you can't control. You may have a general feeling of fear and worry, or you may fear a specific place or event. So here are some symptoms: increased heart rate, rapid breathing, restlessness, trouble concentrating, and difficulty falling asleep.
Are there tests that diagnose anxiety?
A single test can't diagnose anxiety. Instead, an anxiety diagnosis requires a lengthy process of physical examination, mental health evaluations, and psychological questionnaires. Some doctors may conduct a physical exam, including blood or urine tests, to rule out underlying medical conditions that could contribute to symptoms you're experiencing. Several anxiety tests and scales are also used to help your doctor assess the level of anxiety you're experiencing.
What are treatments for anxiety?
Once you've been diagnosed with anxiety, you can explore treatment options with your doctor. For some people, medical treatment isn't necessary. Lifestyle changes may be enough to cope with the symptoms. In moderate or severe cases, however, treatment can help you overcome the symptoms and lead a more manageable day-to-day life. Treatment for anxiety falls into two categories. First one is the psychotherapy, and the second one is the medication. Meeting with a therapist or psychologist can help you learn tools to use and strategies to cope up with anxiety when it occurs. Medications typically used to treat anxiety include antidepressants and sedatives. They work to balance brain chemistry, prevent episodes of anxiety, and ward off the most severe symptoms of the disorder.
What natural remedies are used for anxiety?
Lifestyle changes can be an effective way to relieve some of the stress and anxiety you may cope with every day. Most of the natural remedies consist of caring for your body, participating in healthy activities, and eliminating unhealthy ones. These include getting enough sleep, meditating, staying active and exercising, eating a healthy diet, staying active and working out, avoiding alcohol, avoiding caffeine, and quitting smoking cigarettes.
How to help children with anxiety?
Anxiety in children is natural and common. In fact, 1 in 8 children will experience anxiety. As children grow up and learn from their parents, friends, and caretakers, they typically develop the skills to calm themselves and cope with feelings of anxiety. But anxiety in children can also become chronic and persistent, developing into an anxiety disorder. Uncontrolled anxiety may begin to interfere with daily activities, and children may avoid interacting with their peers or family members. How to know if children are experiencing anxiety? Here are the symptoms: jitteryness, irritability, sleeplessness, feelings of fear, shame, and feeling of isolation. Anxiety treatment for children includes cognitive behavioral therapy or talk therapy and medications.
Can food treat anxiety?
Medication and talk therapy are commonly used to treat anxiety. Lifestyle changes like getting enough sleep, and regular exercise can also help. In addition, some research suggests that food you eat may have a beneficial impact on your brain if you frequently experience anxiety. These foods include salmon, chamomile, turmeric, dark chocolate, yogurt, and green tea. Always remember, anxiety disorders can be treated with medication, psychotherapy, or a combination of the two. Some people who have a mild anxiety disorder or a fear of something they can easily avoid decide to live with the condition and to not seek treatment. It's important to understand that anxiety disorders can be treated even in severe cases. Although anxiety usually doesn't go away, you can learn to manage it and live a happy, healthy life.
Thank you for listening. I hope that you learned a lot from this topic.